So in Finland, we have a rheumatism week every October. And actually, the World Arthritis Day was presented by Finland in the present to EULAR, and that's how it started. But we want to have the whole week, and every year we have a different theme for the year. So the part of this campaign, Don't Delay, Connect Today, last year theme was positive encounters. In other words, it's the communication and connection between health professionals and the patients during the appointment. We find it's very important. Just let you know that some of the project cost has been sponsored by Pfizer, but they hadn't done anything for the project. We just got the money from them, and you are allowed to take pictures. So the main objectives of this campaign was to inform people of the symptoms of rheumatoid arthritis and encourage them to visit doctor, and to give advice to the patient on how to prepare for the doctor's appointment, because many times people say that they didn't ask all the questions they wanted, or they forgot something, or they were too afraid to ask everything what they was concerned. And the campaign also included a section directed to rheumatologists and rheumatology nurses to advise them of the importance of the encounter and the creation of the treatment plan. And of course also to increase awareness about our association and get new members. So first we carried out a survey about the need for treatment plan, and it was terrible to find out that less than 30% of the patients know they plan. And if we think that they meet doctors once a year and the rest of the time they have to take care of themselves by themselves, so it's terrible that they don't actually understand their treatment plan wholly. So additionally, 72% of those who knew their plan are better committed and more satisfied with their doctors and the treatment on the whole. And on the remainder, only 33% are satisfied. So it's a small thing to do, but make that appointment and the treatment much more valuable. So we found out that a positive encounter between doctor and patient can lead to good relationship, follow-up care, and positive health outcomes. So these are the main methods what we did. Our campaign is always multi-channel campaigns, and there are many other target groups contacted. So we mailed brochures to the importance of the treatment plan to Finnish rheumatologist and arthritis treatment unit. And because it was the arthritis week, we also wanted to thank them for the important work they are doing for our patients. So for the doctors, we attach a gift card for fruit, and for the nurses' room, we send a box of fruit. And we also sent an informative video about the importance of positive encounters. And then we sent flyers and posters to our member association. We have 145 member associations all over in Finland, and so they handed out those flyers for the people with rheumatic diseases. And we also created the video for the people suffering rheumatic diseases and wider public. And also ran out a radio campaign run by 92 radio channels nationwide. So we wanted to have spread the information very widely. And then we had a standard parliament, because in Finnish law it states that the treatment plan should be made if needed. So what we want to take away this word if needed. We think that all the patients with a long-term disease should have treatment plan, and they should know it. And then we also publish advertisements in medical magazines. So this is material aimed for professionals, and then was the video for professionals. This was for the patient, and there was also memory list you can go through before the appointment. And then we had also video for patients, and this is about the radio ad. So you can see the whole Finland there. We covered almost all Finland and reached about 2 million people out of 5 million Finnish people. So the results. So patients reported being better prepared for the doctor's appointment, and they have written down important questions in advance. And the professional recognized our message, and we were invited to design a national treatment path with rheumatism professionals for children with JIA. And also the main hospitals are involved and will start to use it, so this is very important. And then we got a free TV airtime for the patient video on the main national TV channel. And the Finnish Society for Rheumatology offered us the opportunity to promote our campaign at the Scandinavian Congress of Rheumatology. So, and there we told them about the importance of positive encounters with patients. And this is the treatment part what we made with the hospitals. And our association is involved in many ways, and there are a lot of links to our internet pages, and there are also many things about the peer support. So, yes, I'm happy to tell you more later on. Thank you.